Do you have a fast brain because you're wired for stimulation or because you're terrified of what might happen next? Let's talk about ADHD versus anxiety, one of the most common rule outs in my office when someone thinks they have either one of those conditions or maybe both. ADHD and anxiety can look identical on the surface. The fidgeting, the trouble sleeping, the losing focus, but the biology under the hood is completely different. Today, we're figuring out which one is driving you. And of course, it is possible to have both. So the biggest difference is the source of the distraction. With ADHD, you lose focus because your brain is actually under-aroused. That's why we treat it with stimulants. It's searching for a hit of dopamine, so it jumps to the next shiny thing because the current task is boring. It's a constant pursuit of stimulation to bring your brain up to a typical level of stimulation. Now, with anxiety, you lose focus because your brain is over-aroused. So your amygdala has detected a threat, that little emotional center. So it pulls you away from your work to scan for danger. It's a pursuit of safety. So pursuit of stimulation versus pursuit of safety. ADHD racing thoughts are like a pinball machine. You're thinking about a project, then a song, then what you want for dinner. It's erratic, it's scattered. Anxiety racing thoughts are like a hamster wheel. So you're thinking about that one email that you sent, then the mistake that you made, then the worst case scenario. It's repetitive and focused on what if. So how do you feel when you have a big task to do? Well, if it's ADHD, you want to do it, but you can't get your engine to start. You feel paralyzed by the steps. This is executive dysfunction. Sits up here in the frontal lobe. With anxiety, you're afraid to start because you're worried it won't be perfect or you'll fail. This is apprehension. So executive function versus apprehension. One is a lack of fuel, dopamine. The other is too much brake or cortisol. So dopamine in ADHD, cortisol in anxiety. Here's the kicker. Many people have both, like I said. Untreated ADHD often causes anxiety because you're constantly worried about the things you've forgotten or the deadlines that you've missed, right? It's this vicious sort of cycle. A thorough diagnostic interview with a licensed psychologist is a great way to help sort this out. Beyond that, interestingly enough, sometimes medications actually help sort it out. There is some trial and error there, which can be a pain. But if you treat the anxiety, but the brain stays scattered, it might be ADHD hardware. If you treat the ADHD and the what ifs disappear, the anxiety was just a symptom of the chaos. So, is your brain seeking a distraction or seeking a safe harbor? Let me know which one sounds like you in the comments, and be sure to share this video with someone who might be wrestling with one or both of these things. And don't forget to give me a follow because our next video is a deep dive into why ADHD meds can actually make some people more anxious.